I had a car accident July 30th of last year, 2018, and I had a slap tear and a supraspinatus tear as a result of it. So we did some therapy. It got better. I gained some motion, but not all the way. I am restricted in internal rotation significantly. So I can put my hand to my right pocket, but not beyond that. And that's where we're standing. I can hardly lean on my right elbow to roll over to my right side, for example. And that's it. I would say lifting more than 10 pounds would be uncomfortable.
And what kind of a procedure do they plan for you?
They are going to repair the slap tear and the supraspinatus. Other details I didn't talk to the surgeon about it.
Excellent. So if you have someone like that, you could just relax your hands, and you're looking to see, you know, what's happening. How you could rest your hands on your belly if you like. Look to see what is the posturing like here. His humeral head, we saw him sitting just a moment ago, was anteriorly glided. His scap is protracted. Now, surgery or no surgery, if that remains that way, he's going to continue to aggravate the same area that they surgically repaired, possibly undoing it, right? So you want to see, what is the skin glide like? We're just taking it from the basics. We looked at the posture. Medial glide, no lateral glide. Inferior glide, superior glide. Inferior, a little bit stiff at the end compared to the other side. Superior glide, not bad. But that lateral glide is pretty much non-existent. So if you think about muscles oriented there, we think of pecs, anterior deltoid. Is it okay to work over the chest here?
Yes.
So I could see what's the glide like there. Tight lateral glide right across the pecs. So high correlation between the skin glide and the joint range of motion, which leads us to that. So George, bring your hands overhead. Show us your range of motion. And you can see the difference side to side. And come on down. Any pain to do that?
From here on, yes. About here, I start having pain.
Okay.
I can go there.
So there. And stop. Don't stay. 0 to 10, how bad was the pain at the end?
I'd say 8.
8 out of 10. Now, show us your abduction. So bring your arms out to the side. Do 2 arms so we can compare. Up, 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 and overhead. So there's abduction.
Actually, yeah.
And
It's about 8.
it's about an 8 pain, so come on down. Don't hurt yourself. And now we're going to do some external and internal rotation. So we're just going to bring this arm out here at a right angle. So external rotation. Use external rotation. Nothing to write home about there. Internal rotation. Immediately, he didn't even start internal. The humeral head just popped right forward. I'll do it for you. See, it just pops. Hurts?
There is pain.
Yeah, a lot of pain. So that's as far as he's going. So I'd just be curious, if we did some work here, would it make a difference on that lack of internal rotation? Now, when people have a labrum tear, we're not going to force that at all because you could damage the labrum, and of course with the impingement from the internal rotation, further damaging the supraspinatus that he already has a problem with. So let's see what happens. Bring his arm out of that restricted position. I'm going to let him just rest on me a little bit here. And let's see about that glide. So you might want to come around this side to get a better view. So glide this way is good, but no lateral glide. So I could just say, okay, I'm just going to take up the slack and hold that lateral glide. But I have an extra hand. So why not use the extra hand and think, okay, lateral glide, is it tighter from here, here? I assess quickly. Oh, I get the best purchase right here, right along those taut bands in his anterior axillary fold. Is this okay to lean on me here?
Yeah.
And a nice cross hand stretch. So we would open that up and hold. And breathe into this for us, George, and just let everything relax. If anything's uncomfortable for any reason, you let me know. This is not going to stay. So I can change my technique. I would have a wider table and rest his arm on it, but if I don't, I could still get my spot that's tightest, feel it and see right over that humeral head. I'm going to actually get that humeral head back a little bit, a little retracted at the scap. Little distraction, better alignment, take up the slack and hold. Feel the stretch through the shoulder?
I don't. I'd say it's moderate, minimal to moderate.
Minimum to moderate stretch. Any pain?
No.
No pain. Good news. So most of this should be relatively comfortable. Again, if you're dealing with someone really tight or post-surgical, yes, there might be some pain, but it should be relatively tolerable. Never to a point they can't tolerate. So just hold that stretch. Can you point using your left hand where you feel the stretch?
Along the biceps.
All along the biceps. And I don't even have his elbow fully extended.
A little bit on the pec here.
A little bit on the pecs too. But I already have the barrier, so just because he doesn't feel it in the middle of the chest or other places, that's okay. I'm at the barrier. There's no reason to add more force. There's no reason to add more tension. I could change the angle. Coming up with a little bit more restriction here. Feel that extra pull?
It's a little more uncomfortable.
Okay, how about if I do this? Better?
Less.
Less uncomfortable. How did I know? Well, he told me, obviously, but his arm relaxed. When I went into that extra range right here, everything tensed up immediately. So I'm always attending to where the tension is and where things relax. And there's a softening right there, so I'm just going to go with that. Feel how that shifted?
Feels good.
Feels good. If I want to go deeper, I could do some muscle play. Muscle play is moving a muscle at about a right angle to its fibers, so transverse to its fibers. So everything he pecs, anterior deltoid, transverse to the fibers is going to come in this way. If I come in and I feel the taut bands he has here, those ropey cords, tight. I'm going to use my palm heel, because fingers aren't comfortable in here. Palm heel, nice. Pick it up, so I'm gripping, lift that pec, peel it away from the axilla, so like a superior glide. Muscle play, picking up a muscle, stretching it at a right angle to the fibers. How is that for you?
Feels very good.
They love muscle play. People, especially with high tone, love muscle play. The pressure, it's deeper because we're going deeper in the muscle. So we're not doing skin gliding and rolling. We're now engaging the muscle, stretching the muscle across its fibers to restore glide between the layers of muscle, between pec and anterior deltoid, between pec and the muscles deep to it. You know the attachments in here. Subscap is attaching in here, lats is attaching in here. A lot of action. Superior humerus. Feel that arm just get heavy, just let go?
Yeah, it feels good.
Feels good. So I'm just letting that go. The arm is heavy. I'm getting a little more horizontal abduction. He didn't need as much support. I still have my muscle play engaged. I'm waiting for another release. I had one release, I'm waiting for another. A little traction through the arm, if you will. You okay with the traction?
Yeah.
The traction is nice to open up glenohumeral space, open up the subacromial space. And most people really impinge at this angle, don't they? So keeping that distraction and just picking up that tight pec, and there it goes again. Feel that heaviness again?
Yeah.
So-
A little uncomfortable. but
A little
only
uncomfortable. You okay with it?
Yeah.
And releasing. And so that's the end point there. So I'm going to have you come back down nice and easy. And just curious if you would show us your overhead motion again.
Wow.
That's substantially different. Did I have to spend 15 minutes on him? No. So if you had 5 or 10 minutes in a visit, can you add something to him? Can you add value here? And he's pre-surgical. Do you think he might get a better result if he goes into surgery with better range of motion
Yeah.
than less? Let's see about the internal rotation. I know this is not his favorite. So come in, see what you got.
Discomfort starts from here.
Discomfort.
I can go another maybe.
More range, but this is impingement. We do not force it.
I can go.
Don't force. He's extending his elbow, cheating left and right, all of that. The humeral head is popping up. He thinks he could go, but he's really, we're not faking you out there. This is popping up. So what I can do here, if I'd like, and see how you feel with this. I'm going to distract here. So I got a nice distraction, open up the joint. I don't like this still jacked up a little bit. Push that shoulder blade down a little for me. Good, good. Let his body weight plant it for me. Good, that's perfect. Now, I could distract from here.
Feels good.
Feels good. And let this come out. Can you hold that stretch a bit?
Yeah, it feels good actually.
Try it again. So with a little more distraction, I could even use my forearm, get the whole pec. I'm not digging my olecranon into him. My forearm. And stretch. Now, any of you do PNF, hold, relax kind of stuff? George, pull your hand up to the ceiling very lightly. Very lightly, that's it. And relax. So I could add a look and track, relax. I got the myofascial stretch muscle play to his pec with my whole forearm, saving my hand. Pull up to the ceiling again, very lightly, going faster than it would with a patient for demo purposes, and relax. And as he relaxes, get a little bit more. So combining muscle energy with myofascial works better than myofascial alone. There's research studies on that. You have an extensive literature base in the back of your book. Okay, and let's just see for kicks. We just did that little bit. And let's try your internal rotation again. Not elbow extension, internal rotation. He just keeps trying to extend that elbow, doesn't he? But I'm keeping this down. Feel the difference? Yeah.
I mean, I'm not aware where I'm cheating, just I'm just
Exactly.
trying to bring it down.
He's doing what comes naturally. Now show us your abduction. Substantially better than a few minutes ago. So might he want to have maybe 2 or 3 visits before surgery to make sure we get this unlocked so he goes in with a more normal joint? Absolutely. Thank you so much, George.
Thank you.
Fantastic.